European nations are taking steps to slowly open up after weeks of lockdown. Germany is allowing smaller shops to reopen in what's been called a cautious first step. And shops with floor areas not more than 800 square meters will be allowed to operate as long as strict hygiene controls are in place. Chancellor Angela Merkel has warned against complacency. She says she's greatly concerned people will become lax about wearing masks and maintaining safe distancing.
Es ist unangenehm, aber wenn es notwendig ist, dann ist es halt so.
Und machen Sie dann auch mit irgendwie?
Mach ich, na klar. Wir haben es heute aus Spaß ausprobiert, weil er das mitmachen wollte. Aber demnächst, ja, wo es sein muss, da werden wir das wahrscheinlich machen, ja. Michaela.
Norway is reopening preschools, with experts saying children are less likely to get the virus. Many shops remain open, but bars and restaurants are still closed. Prague in the Czech Republic has allowed shoppers to visit outdoor markets for the first time in over a month. It's part of plans to slowly open up shops and services.
It was very nice actually, because all the time was everything closed and you can just shop or wait outside until the people will bring you what you ask for. And it was actually very nice to see the products and just choose for your own and to speak a little bit with the owners.
Hard-hit Spain is looking at allowing children playtime outside, even though the nationwide lockdown has been extended. While France, which is hoping to ease its lockdown next month, says it's likely to require commuters to wear face masks on public transport. As several countries begin to take precautious steps towards easing lockdown measures, how soon is too soon? For a closer look, we're joined by infectious disease expert Professor Dale Fisher in Singapore. Professor Fisher, thanks for joining us. First up, so what are some good signs we should be seeing to know if a country is ready to come out of a lockdown?
Thanks, Glenda. There's three things really that can happen during a lockdown, and it depends a little on when you went into the lockdown. So the first is transmission will come under control. And that's a natural thing, because if you stop human interaction, then the virus can't go from human to human. So you expect lockdowns to control transmission. The other thing is if you went into a lockdown with hospital systems overwhelmed, as we saw in Europe, for instance, then during a lockdown, you will get your health system back. You'll get your beds back, your ventilators back, one way or the other. And that's another part of what you see during the lockdown. The third thing is establishing all those public health interventions, which actually Singapore is very good at, which is the testing and the isolation of cases, the contact tracing, the quarantine. And this remains the backbone of the response against this virus. So, for instance, in Singapore's situation, our circuit breaker won't really include ramping up those interventions, because we were already good at them. But so we're looking at basically controlling transmission. New Zealand, again, I don't think it had a problem with health systems being overwhelmed, but they were worried about their transmissions and they locked down early. So I'd say countries like that are ready, and we're going to learn a lot.
So as countries sort of make moves to come out of lockdowns, what's the best way to do this? A gradual approach preferred? What are some of the advantages of lifting restrictions slowly?
You certainly don't flick the switch and come out dancing in the street. The battle is very much still on. I think each country will need to look at the priorities. I think every aspect of society, whether it's social or economic, will need to assess everything based on safety and how important that is. So for some countries it might be returning religious things, others it might be sport. So you'll see different countries prioritise different things, but it'll always be based on safety as well. So I think it's a long time before, for instance, you'll see big crowds at sports, for instance.
So saying that, Professor, what challenges will governments and people face? Is a rollback of easing measures possible?
So this might be the other thing. Maybe governments will return things that can also be undone quite easily. So for instance, if you were doing airlines, let's open up that travel route. That might be a bit hard to stop again. So maybe that would be sort of a slower return. I'm just sort of making up examples, but complacency is definitely a concern, and clearly people are very happy to come out of their lockdowns, but people need to have memories of what the lockdown was like and be afraid that returning to that is possible.
Well, let's expand on that example you gave us about borders, and they're still closed in many parts of the world. How will governments decide when to ease these restrictions and allow travel between countries?
I think they'll probably do it the way it emerged. And whenever a high prevalence country was identified, then that's where the travel restrictions were put in place. So you could argue now that Singapore could have good connections with, say, Hong Kong, Taiwan, China, Australia, New Zealand. These are low prevalence countries, and maybe it could be opened up in that way. Of course, they'd have to take us.
All right. Well, many thanks for your thoughts this evening. Professor Dale Fisher from the Yong Lu Lin School of Medicine here in Singapore.